The pharmacists here at South High are awesome. Cheryl in particular, I work with her fairly frequently, and she teaches me something new multiple times every single time I work with her. She's taught me so much about the data behind the medications, not just what they're used for. So the pharmacists here save my butt numerous times and really help out with the patient care, and the patients are better off for it.
My favorite thing about working at South High is 100% the people there, from the staff to the patients. They're all just incredible. I feel honored to work alongside everyone from social work to our dietitians to our nursing staff, even our registration, and Rob, our security guard, are all just amazing people. And of course, the patients just are fantastic in their own way. They bring such incredible stories and lessons to all of us. And I honestly feel so honored to care for them. I think it's just the concept of family that we have. I think everyone truly enjoys the work that we do, and the patients make us laugh and make us want to come back to work the next day. And I think we just have a great family dynamic where everyone works as one team with one goal, and I think that's what keeps people coming back and staying there. I'll be very sad to leave at the end of this year. Not that I'm not comfortable at OSU or at Nationwide, but I feel like our clinic is like our home base that only med peds people go to. We don't have categoricals coming in. It's kind of our place. And when I think of our program, I think of South High. Dr. Flanagan, I feel like he can truly speak to like my clinic progress, and that he's me kind of grow and blossom and change over the last 4 years. It breaks my heart that they can't come to our clinic because it's seriously the greatest. It's so great. So I know it's usually at the end of the day on the interview day, and everyone's tired and exhausted. And I remember being in that same place, like exhausted. But I just remember still walking through that clinic and being like, this is really cool. Like, this is theirs. They own this. Come see it. I don't know. It's truly where the magic happens, and where you grow and blossom as a physician in a different way than you do on inpatient. And I think it's a super special place.
My name is Angela, and I'm a dietitian here at South High. I've been here for over 5 years now, and I love working here at South High because we have the best staff and the best residents and the best attending.
My name is Kelly. I'm a medical assistant here at South High Primary Care. I love working at South High just because I came in super green, didn't know anything, and everybody was so welcoming. And I've been given the opportunity to present that same warmness to others that have come in and are trying to learn our little clinic here. We do try to uphold the NCH policy of asking questions, so we don't want anyone to feel like they're just walking around without any support. So I think that's the biggest thing here at South High that has been helpful, is you don't ever feel like you're alone.
I love that Dr. Brundrett has been our lead physician. She really advocates for the residents and the staff, so she can see both sides of how we work together and work separately in ways, because obviously the staff are here daily. And
come to South High!
Hi guys, we're at South High and we love it here.
It's the best. We've got the best staff and nurses, and we all get to hang out together.
And all the med peds come here, so this is our one spot where we all get to be together once a week, and it's awesome.
Not too bad.
How great is it here?
It's so great. Hey everybody, it's Dr. Brundrett, the medical director at South High Primary Care. I just wanted to say a quick hi and just let you know that I hope to see all of you future med pedsers in person in the future. I hope that you get a sense of how great South High is through this video that the residents are making. To me, it's the most incredible place to be spending my time. Every time I walk in, I feel a complete sense of home. When I'm there, we combine the best, I think, at the clinic. We have the most amazing staff. All of our residents are so dedicated to helping our community and serving those who need it the most, and we have excellent patient care and medical education there. So if any of that seems like an interest to you, I hope that you come join our team, and I really look forward to meeting all of you soon. Take care.
Hi, I'm the social worker at South High. South High has been an amazing experience. I've only been here for 2 years, but it has been so phenomenal to get to know the residents, the preceptors. Everybody here is wildly supportive of one another and making sure that we are doing everything we possibly can for the patients. And then on top of that, it is so fun. I have never walked out of South High not laughing or just feeling kind of part of this like whole big family.
So I think my favorite thing about working at South High is all the people that you get to work with there. We have an outstanding set of attendings who are really fantastic about teaching. They're really great to learn from. And we have an amazing support staff with pharmacists, nutritionists, and all our nursing staff, and our front desk personnel, and our care coordinators. Everybody is really amazing to work with on a day-to-day basis and really amazing to learn from, so that what you're doing is not just the specific medicine aspect of things, but also learning from our pharmacists and our social workers and our nursing staff as well. I have relied a lot on Angela, who is our nutritionist / lactation consultant, who's been amazing for our patients who are struggling with weight or have diabetes and need specific help, more than I can give in a clinic encounter, about how to kind of adjust their diet to be as healthy as possible. And then she's also been amazing, particularly for our our newborns and our well child checks where somebody needs some help with breastfeeding. She's outstanding about really helping those patients and their families, but then also learn a lot about her when she kind of comes back out of the room and says, hey, here's what I talked about, here's what we went over, and that problem that you're mentioning, here's how we're going to try and work with them to fix it. And so she helps the families a lot, but I also learn a lot from her as well. It is important to have med-peds trained docs that you're working with. There's just kind of an extra level of mentorship that you can get from your clinic attendings. Again, because they know where you've been, they've kind of been down that road, and have an idea of kind of where it can lead. So there's been a fair amount of times where beyond just staffing patients, we have conversations about kind of career or work-life balance or things that I think can be particularly unique to the med-peds experience that you wouldn't otherwise get with a non-med-peds trained attending, which I think gives you a good range of experience, because you get to develop a really good working relationship with that particular clinic attending who you see most often. But at the same time, get exposure to a variety of other really great attendings who maybe have a very slightly different approach or different things that you can learn from them that are unique to the way that they practice. Everybody knows what you're talking about when you talk about South High. And there's a certain level of kind of South High pride and collective experience that you get to share with everybody in the program. And that includes the attendings who work at South High, the nursing staff who works at South High. I think it just adds to kind of the shared experience that is really important when you're going through something that's challenging and fun, and that kind of depth of experience that you have so many other people who share that experience with you. I think the work we do is challenging, but people we do it with make it really fun to do and really educational, because to a person, our attendings are amazing people to learn from. Our nursing staff are super knowledgeable and great to work with. Just the whole support staff is all there kind of pulling in the same direction and always willing to help out. And I think that's, again, a tough impression to get without having met everyone and had a chance to work with people. But it's something that I think I appreciate more than anything else about South High, that I think would be helpful to know if you're trying to pick a program. Where you really get the chance to kind of be the primary provider in ways that you probably aren't when you're kind of a guest in rotating to other clinics, where you are the one seeing the patients, making the decisions, following up on all the labs, communicating with patients and families. I think gives you a really good glimpse as to what kind of primary care looks like. And I think for me has made me lean more towards potentially wanting to do primary care. Because I got a sense for what that lifestyle is, what the challenges are that come with it, but also the really rewarding parts. You start to get more kind of continuity in clinic as you're seeing more of the same patients and are there more often. And I think just in general, having a really positive experience with all the people that you work with there can really make it something that I think makes a lot of our residents think about primary care as a viable option for their career. Managing your own inbox is really important to understanding what kind of the primary care life is like, and also giving you that sense of ownership of your patients, because if it's your lab that you ordered, you're the one who gets to be able to make the decision about kind of what do we do with this result. Or a patient calls in with a question, you're their doctor and you get to help them navigate whatever that problem is that they're facing.
And we love each other, and everyone should come work here. You won't be disappointed.
Amazing. It's so much fun here. Look how much fun we're having.
Hi, South High is the best place ever. I've been here since I was a med student, and now I'm here as a chief, and it's great. I love working here. Everyone's wonderful. You should come here.
South High is wonderful. I think it's one of the best things about our residency program here at Ohio State and nationwide. It's really fun to have a bunch of different levels of residents in your clinic session. You get to pick their brains, especially as an intern, about their experiences, not only on the outpatient side here in clinic, but on inpatient rotations as well. And I think it allows you to bond with the other levels of the class, which is great. Our ancillary staff here are excellent as well. I think it's great that we have access to a social worker, dietitian, pharmacist, and now a psychologist in the clinic itself. It allows easy access for your patients to these resources. You don't have to refer them elsewhere. So I think it's really special to have that right here in clinic. And all of our preceptors are Med-Peds trained, which I think really gives a unique perspective, and they know how to navigate between going from a well child visit to an adult patient in the same clinic session. And they're able to give you guidance on that I think is unique to having a separate clinic experience.
Okay, Rachel, if you were stuck on a desert island, who would you want from South High to be there?
I think I would bring two people. I would bring Kelly, our MA, because she would make me smile no matter what. And I would bring Melissa from registration because she would somehow figure out how to get us off the island because she always makes magic happen.
Yes, she does. Yes, she would. Those are great.
Like I said, South High is awesome.
Yeah.
I would come here, do residency here. You'll get a fantastic experience.
Sarah, who are your South High MVPs?
So I have two. The first is Dahlia, our social worker. Numerous times during clinic, I go and I say, Dahlia, can you help me with patient? And she hits it out of the ballpark every time, coming up with resources and talking with patients and making their visits go smoothly and setting them up with resources. My second MVP is Angela. She's our dietitian, and she is incredibly helpful. I worked with her recently, and she just improved patient care for this patient we had, and hopefully we'll be setting them up for success throughout their life.
Sweet.